In this presentation, we will be given a basic introduction into the specialism of orthodontics discipline. This is provided by Presidential.com. So, our objectives for this presentation is to identify or define what orthodontic means to us, to explain the difference between the laboratory and clinical therapy appliance systems available, to look at some of the roles and responsibilities of some dental professionals who may be involved in orthodontic treatment, and also to look and identify various different types of appliances available to us. We can define orthodontics as a specialized branch of dentistry which allows us to manage facial growth, development of dentition and occlusion, and it allows us to look at how the teeth interdigitate together and prevents irregularities from occurring. This is commonly known as malocclusion. This is something that we'll look at further within the slides. In order for us to correct these malocclusions, there's various different appliances or therapy systems that's available to us. A basic definition of malocclusion essentially means the teeth does not meet together correctly, which means they are misaligned. There are various different categories of malocclusion, and just to briefly outline them, we can term them as Class 1, Class 2, and Class 3. So Class 1 being the most common is what we determine as a normal bite, where the upper teeth slightly overlaps the lower teeth. Class 2 malocclusion has an overbite, which is when the upper jaw protrudes severely over the lower jaw. And Class 3 would be an underbite, where the lower jaw protrudes forwards or juts forward, causing the lower joint teeth to overlap the upper teeth. There are more complex dental terminologies for this, which we will look at in a bit more detail. So now let's look at different types of classification, starting with Class 1 classification. The way we are going to do this is by using a standard language known for identifying posterior relationship and anterior relationship. One way we can do this is by using Angles classification. Angles classification was developed by Edward Angle, who is termed as the father of modern orthodontics. Edward Angles developed a system in order to simplify the way we can identify different types of orthodontic treatment systems. Edward Angles was based on posterior relationship, and for Class 1, it would mean the mesiobuccal cusp of the upper first molar occludes with the mesiobuccal groove of the lower first molar. So Angles classification is always based on posterior relationship. The second type would be the BSI, which is the British Standards Incisor classification. This classification is used to identify incisor relationship. And as illustrated in the diagram, the Class 1 classification would be the lower incisor edge occluding or lies immediately below the cingulum plateau. So now we use the same classifications for Class 2 occlusion. The difference with Class 2 occlusion is that for Class 2 occlusion, we can have Division 1, which is based on the upper central incisors, and Division 2, which is also based on the upper central incisors. The only difference is that Division 1 is proclined, which means the upper central are protruding forward, which means pushing forward, and Division 2 is retroclined, which means retruded in or tucked further in. And again, as illustrated, the same classification used for Class 3. As we have looked at Class 1, Class 2, and Class 3 different types of occlusion, this image illustrates the facial profile that we would see when we're looking at these type of classifications. Now, we've spoken about malocclusion, and we've spoken about a way of identifying class 1, class 2, and class 3. Within these occlusal and facial profiles, we can have various different types of irregularities and complications. All these different types of occlusions that we've looked at can have various different types of malocclusion. These malocclusions can range from cross bites, open bites, protruded teeth, spacing, and these may be caused by oral habits, diet, and also sometimes genetic defects. There are 4 fundamental reasons why we undertake orthodontic treatment. One would be to restore dental arch stability. 2, to improve aesthetics. 3, to restore function. And 4, to improve the patient's oral health. It's very important to identify all these different types of irregularities and different forms of malocclusions in order to prevent a more invasive treatment later on in life. The reason why we term orthodontics as a specialized branch of dentistry is because it demands extra training in order to adequately treatment plan and understand the complexity of achieving the correct treatment for that particular patient. There are some disadvantages to orthodontic treatment. Some of these can be root resorption, soft tissue damage, and relapse. This slide illustrates some of the most common types of tooth movements that's available to us. Each of these tooth movements can be studied in more detail to get a better understanding of the complexities of them. But this briefly highlights the different types of tooth movements there are, and we'll look at some of the appliances that we can use to achieve these different types of tooth movements. These images illustrate what occurs within the periodontum and alveolar bone during the process of tooth movement. The process is known as bone remodeling, and the main 2 cells involved are osteoblasts and osteoclasts. As pressure is put against the alveolar bone, cells known as osteoclasts eats away at the alveolar bone, and on the tension side where the gap is being created, cells known as osteoblasts would remodel the bone in order to fill in that space. Further reading would be needed in order to better get an understanding of this whole process. Within orthodontics, we can have 2 different types of therapy systems. We can have the clinical side and the technical side. Let's look at these in a bit more detail. We are more familiar with the orthodontist, who's known to place the actual brackets and arch wire bands onto the patient's mouth. This would be the fixed appliances within the clinical setting. However, the dental technician plays an important role in creating removable appliances, fixed components, myofunctional appliances, and in some cases, orthodontic surgical splints. Within these appliance therapy systems, if we look at the laboratory side, fixed and removable appliances can be made within the laboratory. These appliances can be made incorporating active components and some made passive in their nature. Within the clinical side, we would have the normal, commonly known braces, which would be placed onto the patient's mouth. So essentially fixed, meaning the patients would not be able to take it out. And the last and most important stage is the retention stage. As we highlighted before, due to relapse, finding a way to retain the teeth in their current position is very important. Removable appliances would be appliances placed in the patient's mouth where the patient would have the ability to remove it when eating, sleeping if needed, and also to clean and maintain the appliance. There is a wide variety of options available to us when it comes to removable appliances. Removable appliances are easy to make, cost-effective, and allow us to incorporate a wide variety of different components to achieve different types of aims at the same time. This illustrates one appliance where we have different components. So we have the Adam's crisp, which provides retention. We also have posterior cupping, which prevents the posterior teeth from over-erupting. The anterior section has 2 Z-springs, and we also have a south end clasp on the 2 central incisors. These also illustrate the wide variety of options that's available to us from removable appliances. Fixed appliance would be carried out within a clinical setting by the orthodontist. This essentially means the patient would not be able to take it out and would have to have regular visits to have them adjusted and maintained. There are 2 different types or options available to us. One is the clinical type of fixed appliances, and the second is the laboratory type of fixed appliances. This illustrates different types of laboratory fixed appliances. The molar bands would be cemented onto the teeth by the clinician, and the laboratory technician would carry out the wire work and various different components needed. On occasion, these components would be soldered onto the bands and sent back to the clinic for the clinician to fit into the patient's mouth. The most common types of clinical fixed appliances we may be aware of are your typical braces, which incorporates arch wires and cemented onto the tooth, most commonly with composite. The 2 types identified here are the beg and the edgewise appliance. So now let's look at functional appliance therapy systems, or myofunctional type of appliances. These type of appliances use a combination of the soft tissue and the development of the jaw and bone to achieve a specific aim. Functional appliances gives us the option to correct open bites, help patients break habits, limit or restrict the amount of pressure added by the soft tissue during bone development. One of the most important stages of orthodontic treatment is the retention stage. This is to prevent a relapse of all the hard work that's gone into achieving the desired outcome. There are a variety of different appliances available to us when it comes to retention. This would be discussed and chosen by the clinician during the treatment planning stage in order to find the best possible type of retentive appliance for that particular patient. Each of these retention appliances have their unique individual advantages and disadvantages. We hope this presentation has given you a brief understanding of orthodontic discipline, the therapy systems available, and also the reasons why we undertake orthodontic treatment. Thank you for your time, and we hope to see you back soon.